Hello there. This is a quick demonstrational video describing a few recent changes with the general HPI form, also known as the History of Present Illness form for new patients. You can find this form by clicking the red HPI button located on the first tab of the main TMD 2010 Office Encounter form. So let's get right into the changes. The first item on the list is a change we've recently incorporated for Dr. McGee. In the past, he has received charts that state the patient had an injury, but there just wasn't enough information about the injury as he would have liked to see. So for this change, we'll notice that when we answer the question, did a patient have an injury, for yes, we'll get a statement at the bottom in red text saying that we need to fill out more information about the injury for Dr. McGee. Here, all you'll have to do is select anything under the did you have an injury question for the blocking message to go away. It doesn't matter what box you click or anything like that, as long as you have any additional information about the injury that can help Dr. McGee determine the best path of treatment for that patient. So like I said, it doesn't matter what area you fill in, as long as any additional information is filled in, it will remove the blocking message from the bottom and allow you to continue. This is only in effect for Dr. McGee, and that is determined by when Dr. McGee's name is filled in as either the provider or the supervising physician on the main TMD encounter that we were just on. The purpose of this update is to ensure that Dr. McGee gets the additional information about the injury that he has came to us and requested. The next update to this form involves a piece in the pain management section. Currently, there is a question in the pain management section that asks if the patient has previously seen another pain management physician before. This question is not new. However, from now on, it will block you from navigating for any of the 4 pain doctors, Tasha Bowers, and Barb Starry until it is answered. If it is not one of the 4 pain physicians, Tasha or Barb, then this question will not be required. As you can see on the form, red text will appear at the bottom, prompting you to fill in more information about previous pain management. If the patient has not seen a previous pain management physician, simply click no and continue on the form. However, for this example, we'll say that the patient did have a previous pain management physician and the patient saw Dr. Smith. And as you can see, once that information is filled in, the navigation buttons at the bottom reappear and you can continue on filling out the form as needed. The next 2 updates are both requests from Dr. Berghoff. The first update is from now on, whenever Dr. Berghoff is selected as either the ordering provider or the supervising physician on the main TMD form, a required ADLs button will appear on the HPI form. To fulfill this part of the requirement, all you'll have to do is simply click on the ADLs button and it will take you to a separate form where you can fill in additional information about that patient that Dr. Berghoff is wanting to see. Not all of this, or actually not any of this information, is required on this form. However, the more you fill out, the happier Dr. Berghoff will be in the long run. So when you're all done filling out this form, you'll simply hit the Return to HPI button in the bottom left, and it will not only send the text back to the HPI form, but will also unblock the form. Since this is a 2-part requirement, there's still red text at the bottom. As you can see, the red text at the bottom says, please address all treatments for Dr. Berghoff, and then it lists a set of things that Dr. Berghoff wants to have addressed. This is where our last change comes into play, and it is basically a slight revamp of the old current treatments section. Previously, these were separated by radio buttons where you would fill in for gave relief, did not give relief, or has not tried, and as you answered them, you wouldn't be able to see what you filled in previously unless you click the radio button to toggle back and forth between those visibility regions. Here, it's all sort of laid out in front of you, along with a new functionality that we've added where if you click an item in one list, it'll drop itself from the other list since you really only need to address it in one location. All that Dr. Berghoff is asking for this requirement is that you address each item in the list. So here, we'll say that the patient has tried these 3 things which gave relief, he tried these other 3 that didn't give relief, and the very last one looks like it's going to be physical therapy. And as you can see, now that all of the items are addressed for Dr. Berghoff, the navigation buttons at the bottom will reappear and you can continue on filling out the form as needed. This is all that Dr. Berghoff has asked, is that you just address each item in these lists, and with this new functionality, it'll be much easier for you to address all of them and make Dr. Berghoff happier.